World Health Expo WHX held at Victoria Island, Lagos between 2nd to 4th June 2025 drew conversations around challenges confronting the healthcare industry to ensure adequate representation of all sectors within the healthcare ecosystem. Different halls were set up for conference. Amongst these was West African Institute of Public Health Symposium, where vaccine optimization, offtake and supply chain took center stage. Professor Oyewole Tomore, Professor of Virology, Chairman of the symposium, called for local vaccine production in Nigeria.
Producing vaccine requires a high level of technology, and we need to put that in place first. With the resources we have and the commitment and that pride in your country, there's something we cannot do. We're going to produce locally. You create job for people. Government is going to get tax on all those people, and then you can plan better. There's nothing about stock out or nothing because you are producing in your own country yourself.
Dr. Aisha Usman, Technical Advisor, Lassa Fever Vaccine Coalition, West African Health Organization, advocated for synergy between researchers and implementers, as well as government, for more informed policies creation.
We have some of these findings from implemented research documented somewhere that are not being used. So there's need for that coordination between researchers and implementers. You need to come together. There's need for that coordination, and also there's need to political will. If the findings are there, it's been presented, but we need to move for that to action, making sure that findings from research are actually used to improve the health of the population. So there's need for that investment. We need to invest in research because you need data. If you don't have data, accurate data, you cannot make informed decisions. And if you make a silly or stupid decision, it's going to have effect on the population. So we need to get it right.
Timi Omole, co-founder and principal advisor, Pejuan Integrated Services, addressed optimization of vaccine supply chain.
We need to create a business case for why vaccines should be produced in Africa. And one of the very obvious cases is that this is where the customer for those vaccines are. So why do you need to produce them far away and bring them to the customer? Basically, reduce the distance between the production to where it is used, utilize technology to circumvent the limitations, and then build the people that will run the supply chain.
Dr. Yaya Disu, Executive Director, AfriHealth for Social Development and Impact, ASDI, discussed the role of public health policy in vaccine offtake.
Immunization is to save lives of our children, including adults, because COVID-19 vaccine is for both adults and the lives. And there are challenges that can prevent this uptake of these vaccines. And then it's not something that you and I can solve. Some are individual, some at societal level, some are policy-making level, and that's where we need government to come in and address it. Issue of hesitancy, right, to ensure that the right information goes out and then engage the right stakeholders to have conversations about these vaccines, to address the fears of the people and tell them the truth about these vaccines, the benefits, and then how they can address issues of side effects of vaccines.
While Sheyi Nangushe, Programs Manager, West African Institute of Public Health, WHX, spoke on leveraging digital health in vaccine productions in Africa.
We need better infrastructure, we need to have our workers trained, and then lastly, I think that government needs to go into partnership with the private sector. Okay.
Contribution from the speakers revealed why optimization of vaccine supply chain will bring solution to vaccine challenges in Africa. Reporting from Lagos, Mary Jane Weze, MJMEDIA News.